The Minister of Women Affairs, Mrs. Pauline Tallen, has expressed concern over the health of Nigerian women, identifying ignorance, high cost of healthcare, and inadequate facilities as major impediments to accessing quality care. Tallen expressed concern at the launch of the Nigeria Reproductive, Maternal, Newborn, Child, Adolescent, and Elderly Health Plus Nutrition (RMNCA EH+N) Multi-Stakeholder Partnership Coordination Platform in Abuja.
RMNCAH, which must be kept high on our national political agenda. And this must remain central in the post-2015 development framework. The framework should include clear, realistic targets to end preventable maternal, newborn, and child mortality, and to improve access to sexual and reproductive information services and ensure the realization of sexual and reproductive health and rights. Stakeholders should use existing global platforms and consider new platforms such as the potential RMNCAH Global Financial Facility to better coordinate their RMNCAH investment to increase efficiencies in their allocation to countries. Strengthen political leadership for family planning at country level to create support for contraceptive and sexual and reproductive health and rights. Strengthen accountability for RMNCAH beyond 2030 through a harmonized method. As we are currently experiencing, we should be well focused to further track progress towards 2030 targets for RMNCAH.
The Sultan of Sokoto, Saad Abubakar, said there was need to propose a more robust strategy to engage traditional rulers in the monitoring process for better implementation. Represented by the Emir of Kefi in Nasarawa State, Usman Chindo Yamasa III, the Sultan commended the bold step taken by government and urged members of the committee to carry stakeholders along and ensure the implementation of UHC for all Nigerians.
There is the need to propose by the minister to adopt a more robust strategic and operational mechanism to involve traditional rulers and spiritual leaders in the monitoring aspect of the program in the ministry. The Sultan is grateful for being part of this launch and will always support the noble cause of the ministry. I urge the members of the committee to justify the confidence reposed on them, since there is a compelling evidence that the minister is making effort to bring out results greater than what it used to be.
Professor Innocent Uja, the president of the Nigerian Medical Association, NMA, said Nigeria has all it takes to work toward the achievement of UHC.
The Nigerian Medical Association is in a position to support and work with government and ensure that our women, our children, the elderly will get the best from our service. We have the knowledge, we have the skill, and we have the commitment. But we must work together because we have all that we need to move forward, except for proper coordination. And I believe that we will build capacity. We have that. And also, we are prepared to build capacity. We will be involved in emergency obstetric and neonatal care.
The Commissioner for Health in Cross River, Dr. Betta Edu, who spoke on behalf of the Commissioners for Health Forum, said they were committed to the implementation of the RMNCAE H+N.
Again today, our hearts have been softened by the fact that a new strategy, a new platform to coordinate, reduce wastage, and indeed help Nigeria come out of where it is presently has been brought on board. All the commissioners for health in Nigeria hereby make their commitment to see that they support the Federal Ministry of Health and indeed all key stakeholders to achieve results. We cannot achieve universal health coverage if the states do not work hard at this. We cannot achieve universal coverage if we do not have all the foot on ground in every single state in Nigeria to make the difference. And that's the commitment we're giving this morning. We want to plead that no state should be left behind. We also want to appeal that resources, financial and otherwise, be made available for states to be able to thrive and bring this to complete success.